I'm Rajdeep Kaur, the student ID 1625111224, and today I'm going to do the procedure of wound dressing. So first of all, here, good evening.
Good evening.
How are you?
Fine.
So as prescribed, I can see you are prescribed for a wound dressing procedure. So can you tell me your name?
Surinder Pal Singh,
Okay. Can you tell me your date of birth?
26 January 1969.
Okay. So now I will perform hand hygiene. So I am Rajdeep Kaur, the student nurse of the day, and today I am going to do wound dressing to prevent any further infection in your wound. So moving forward, I need to know two things from you. So I am going to assess the pain, 1 being the least, 10 being the most pain. Can you tell me the level of pain?
2.
Okay. Do you need any medication?
No.
Are you allergic to any medication?
No.
Okay. So as stated by the patient is suffering from mild pain, that is level 2, and patient do not need any sort of medication and have no allergies. So now I will reposition you. Now I am going to put this draw sheet to prevent soiling of the bed. Can you lift your arm? Now I will provide privacy to the patient. I will perform hand hygiene. I will wear my gloves once again. And now here we are going to create a sterile triangle. So here we are going to open a sterile kit. Firstly, we will open the flap away from us. Then to the left hand. Then to the right hand. Make sure it touches nothing else. Pick up the flap towards you and pick up the forceps. And now we will reposition our kit. We will keep it on the edge. Now I will pour the saline solution. And now we are going to remove the dressing. So upon inspection we can see there is no blood. There is serous, that is clear fluid can be seen on the dressing. So in general ideal environment we are going to throw this dressing into the garbage bin, but I do not have another dressing pad, so I am going to reuse this and I am going to keep it. And now we can see the wound of the patient is on the lateral aspect of the arm. Next I am going to check for the length of the wound. Make sure it doesn't touches. So length of the wound is approximately 11 centimeter, and the wound is well approximated. It has closed edges and it is closed with the help of staples. About 6 to 7 staples are being used, and there is no erythema or redness that can be found. And now I am going to palpate your wound. If you feel any pain, do let me know. Do you feel any pain?
No.
So there is no edema or pain that can be felt by the patient. And now we have to remove our gloves and throw it into the garbage bin. We have to perform hand hygiene again and wear new pair of gloves, but I do not have extra pair of gloves, so I am reusing the same gloves. And now we are going to clean the wound. So here we will pick up a swab, dip it into the saline solution, we will squeeze it, and then from the midline, from head end to the toe end, from least contaminated to the most contaminated area, we are going to clean it. And we will discard it in the garbage bin. We will take another swab. We will dip it into the solution. We will squeeze it. We will clean it from the farther side, again from the head to foot end. Discard it in the garbage bin. Take another swab. We will dip it in the saline solution and we will squeeze it. Clean from the nearest side, from head to toe end. After cleaning it, we are going to pad dry it. So we will use the gauze piece. Sorry, I am using the word swab again and again, and it is a gauze piece. We will pad dry it in the middle line. Throw it in the garbage bin. Again, one more. For this side, head to toe, pad dry it. With the last swab from the nearest end, we will pad dry it from head to toe. Throw it in the garbage bin. Nextly, I am going to take a 4x4 gauze piece. I am going to place it on the wound. Lastly, I am going to take a sterile dressing. I will place it over the wound. I am going to tape it. And I am going to write date and time so that the nurse that is in another shift can know at what time and date the dressing of the patient was changed. So now I am going to reposition the client. So I will give you a call bell. So if you need anything, you can ring your call bell and call me. Okay?
Okay.
So at last we can see that the patient has a mild pain, that is level 2 pain, and needed no medication and had no allergies from any sort of medication. Upon inspection of the dressing, we have seen no blood, only serous fluid, that is clear fluid can be seen. And location of the wound is lateral aspect of the arm. Length of the wound is approximately 11 centimeter. The wound was well approximated, that is it had closed edges and it was closed with the help of staples. About 6 to 7 staples were used to close the wound, and there was no redness around the wound, and on palpation the patient felt no pain and no edema was felt by me. And at last we will discard all the material according to the policy of the hospital. Thank you so much.